Thankfully, I came down a bit earlier than I expected to come down, or otherwise it was a bit of a mistake, another mishap. First, I want to thank the Ken Coral's office for the opportunity to raise this issue. This has actually been brought up on a topical issue before, the situation with Tohermore House in Tuam in County Galway. It's a 24-hour mental health facility which is on the site of other mental health facilities such as a day hospital. An issue arose with this towards the end of last year. I think it was around the 21st of December, when a decision by the HSE was to close this 24-hour facility due to what they said was fire safety reasons. There was quite an awful lot of campaigning going over and back in relation to it, and as it turned out, towards the end of January, there was a situation then where the facility, under ministerial pressure, was allowed to, the money was set to be there to remain open. And I think it's very important to understand that this facility received a grant of almost 1.4 million in the years of 2010-2011 to upgrade it. And I just want to quote something that Minister Lynch said herself when she visited the facility in 2011. And what she said was, the development of this integrated campus at Tohermore brings together a range of mental health services which will undoubtedly have a huge beneficial effect, not only in the lives of the patients but also in the lives of their families and friends. Now, I think anyone who would read that quote would make a very clear understanding that Tohermore House, as a 24-hour facility, was a cornerstone of mental health services in Galway and Roscommon. And you can imagine the anger that many people faced when they thought that this facility was going to be closed. Now, as I said, we got to a situation where at the end of January, due to ministerial pressure, the facility was then kept open. But now in the intervening 2 months, we have a situation where money was said to have been allocated to carry out these fire safety works. And what I'm trying to find out today, Minister, is what money has been allocated towards those works, what was the total figure, when will those works be carried out, and when will it be up to a fire safety standard that this residents can start to take in patients once again? Because we've had a situation in the last 2 months where figures of 250,000, 300,000, 360,000 and $500,000 were mentioned as needed to do up Tohermore House. This is a farcical situation. It is ridiculous that what is only a fire safety issue, and I understand how important that it is, that will close the facility that had already had 1.4 million put into it. Now we can't put a figure on what is exactly needed to keep it upgraded. What I want from the Minister today also is that the reason I brought up this topic is I understand that any decision on Tohermore House has been taken in the sense of a review of all mental health services and 24-hour facilities in Galway Roscommon. And what I'd like to find out is who is on this review board? Who is going to be the people supplying the information into this? Because there's great concern over this, because there is issues that the HSE in the West haven't been completely upfront with the patients, with their families and with the staff of Tohermore House throughout this whole process. What I want to find out is, when is this review due to begin? Who are the people who are on this review? How long will the review take? What are the terms of reference? Because the one thing that we have not had in the last 3 months is openness and transparency. Now, I want to say another thing is that an awful lot of the people using this service are in very vulnerable state, and this continued uncertainty as to its future. And a report was released only 2 months ago looking at the people and the problems that they were facing, considering the rumours that were around about the closure. And one quote from that is, it was unstable and distressed, was how she described one person when they found out they might be moved. Another quote from was, the patient has been stable for years in our low support facility. Most of the hostel residents have poor coping skills and the clinical risk is a concern if they are relocated. Now, Minister, I cannot stress enough that for the last 3 months, we've had a situation where there's been a lack of information coming out to the people, the families and the residents. This concern needs to be lifted. Tohermore House must remain a cornerstone of a vision for change within our mental health policy in Tuam. The people of Tuam will not accept anything less. The people of North Galway will not accept anything less. The state cannot put 1.4 million into a facility such as this only a number of years ago to come along and close it. And I think it's important that the Minister Lynch or Minister Riley take a hands-on approach with this, get on top of the HSE West, make sure that that money was spent properly, and I would like to see some confirmation given on that.
Your 4 minutes.
Here, look, I would like to thank the Deputy for raising the matter. I'm taking this issue today on behalf of the Minister for Health. Tuam Mental Health Service caters for the Tuam and Headford catchment areas with a population of approximately 35,000 and a caseload in excess of 800 people. Traditionally, the service was provided at St Bridget's Hospital in East Galway, but gradually over the years, community mental health services in Tuam and Headford have been developed. a report entitled Fire Safety Report on Tohermore, I hope I'm pronouncing that properly, was delivered to the HSE in December last. The report highlighted a number of shortfalls in relation to fire safety, which needed to be addressed as a priority. The assessment focused on relevant issues such as means of escape and associated signage and plans, structural fire precautions and fire equipment, coverage provided by fire alarm and emergency lighting systems, and facilities for the fire service. A local steering group consisting of a mental health clinical director, consultant psychiatrist, director of nursing, occupational therapy manager, business manager, team leader, social worker, and patient representation was formed by the HSE and met to discuss and met to address the challenges outlined in the fire safety report. The steering group has and will continue to liaise with residents and their families as part of the process. The HSE West has implemented improved fire risk assessment and hazard identification measures. All staff and patients have been informed that appropriate actions have been taken, such as a complete ban on smoking in and around the residence structure and improved observation in all areas. To mitigate immediate risks, the HSE are installing a fire alarm system and continues to have hourly fire checks. Preparatory work for the fire alarm system has now been completed. The work is being carried out with the minimum level of disruption to the daily routine of residents. The Executive is currently commissioning a full review of all 24-hour residential facilities for Galway and Roscommon. The outcome of the review will assist in their determination regarding future requirements for the mental health services for these geographical areas. The membership of an expert group to oversee this review is currently being finalised by the area manager and executive clinical director. It is expected that this review will be completed within a 12-week period from the date of commissioning. It should be noted that no other mental health services in the Tuam complex or surrounding areas are affected by the fire safety issue. These include the day hospital, day centre, training centre, workshop, the primary care, CAMHS, CAMS as we know it, and outpatient and psychiatry of later life, which continues to operate as normal. The Deputy can rest assured that the ministers in the department will continue to closely monitor developments on the issue as they occur over the near future.
From the outside, this is no disrespect to the Minister here, of course, this topical issue has become a bit of a farce now where one junior minister comes in with 4 scripts and reads them all out. Because to be quite honest with you, I got that reply from the HSE during the week. And I mean, I've asked a series of questions there in relation to the cost of the fire safety works, who was going to be on the review board, what were the issues what were the terms of reference for the review board. Now, I got this answer a week ago. Now, what I want to see is a situation where the ministers take as much as possible a hands-on approach with this. Because, as I said, we cannot have a situation where you spend 1.4 million upgrading this facility for these residents and their families, to have a situation where we come 2 years later and then we want to have another review of it. This cannot be allowed to continue. And the problem that I have with all this now feeds into a review of all Galway and Roscommon. It's now become a bigger issue. And I think the people of Galway and Roscommon deserve to know what their mental health facility review is all about. And I think it implores us to make sure that if a decision was taken 2 years ago to put this money in, that we come up with a proper long-term solution. I still don't know, leaving this chamber today, how much money has been spent on Tohermore House to this date. When is that house going to take in new patients? That has always been the problem. And again, this is no disrespect to the junior minister here, because this isn't his portfolio, but coming in and reading out a script that I already got from the HSE, almost word for word, is not an acceptable way to do this. And I'm imploring them, if you could do nothing else, but to bring the message back to both Minister Riley and Minister Lynch, that we will not accept any downgrading of the facility in Tohermore, considering the amount of investment that has already been put into it, and that the level of care that these people and their families need and deserve. And this idea that consultation with them is enough, it is not enough. They need to be told where their loved ones will be staying for not the next week, the next month, but the next number of years. The least the state deserves them is that. And I just think it's now time for the ministers to take a hands-on approach with this, and let's get a long-term solution, draw a line under this issue, and secure Tohermore for the future.
Minutes.
I totally agree with the Deputy. I agree that it is farcical that one junior minister would come in and answer across 4 issues. I mean, I can't disagree with you at all, Deputy, on that. But what I would say is that if I know Minister Kathleen Lynch and Minister O'Reilly, and if I know their form, I know that they would engage on a lot of these questions directly with you in terms of who the people are that are on the steering group, the actual names of those people, and in terms of getting more firm details in relation to costings and timelines. But it must be said at the same time that there is patient representation on that group as well, which should, if this process is working properly, properly address the needs of patients and their families. So I tend to agree with the Deputy on this issue. I know that I've had similar experiences in my own area, and I've quite frankly made sure that the Regional Director of Operations was answerable to me in respect of any issues that I would have pertaining to my own geographical area. And I know it's important to raise these issues on the House for the record, but I apologise to the Deputy for my lack of intimate knowledge of the issue. Thank you.
Minister. The next item